Hi, I'm Raj with Sickbay. Sickbay is software that lives inside the hospital and collects and delivers physiologic data at scale. Our teams visit with clients and understand how clinicians, quality folks, and researchers use this novel data set. Today, my colleague Mishan and I are excited to talk to Werner from Vitls, a company that has developed a wearable for continuous monitoring of low acuity hospital patients. Thanks for joining us today.
Thanks for having me.
Hey, good morning, Werner. I know this is going to be a fun discussion because you have a cold and I'm battling a cough, so it'll be really fun for our audience. How are you this morning?
I'm very good. Thanks, Sean. How are you?
Good. Okay, so you and I have been working together a long time. I know people here at Sickbay are fans of your your devices. So talk to me a little bit about why it's important for a hospital to have a healthcare strategy that involves wearables.
Sure. I believe that wearables give the hospital more flexibility to monitor their patients, more continuous data or semi-continuous. So that allows them to see changes for better or worse in a patient's condition very quickly and treat them. And so in doing that, shortening stays, freeing up beds to treat more patients. So there are a lot of advantages to using it. The other thing that actually came up in a meeting with Emma recently was that, is that hospitals don't have to sign these long-term contracts with companies like us. They can use our wearable for a specific population of patients, and then they can use a different one for another population. There's no service level agreements and huge capital expenses. So it gives the hospital, it makes the hospital, as I mentioned, flexibility. It gives them flexibility, and yeah, more data is always good, even though we don't really know how to deal with a lot of data yet, or some hospitals don't. Having that data and being able to look back and create algorithms and machine learning algorithms for that is valuable.
Yeah, it seems like we're getting to the point where it doesn't make sense not to just monitor everyone. And you may use different devices in the same population. You may use different devices in the same use cases. You may use different devices because there are some folks that require a different level of monitoring, but why not just get data on everyone? You don't know when there's going to be an adverse event, and because we're not monitoring everybody, we can't necessarily then start to find those really high value algorithms or high value data points that say, hey, you thought this person was well, right? Raj and I talked yesterday about, we wish that, in our minds, we wish the sensor would go person well, person sick, right? But when we're not monitoring everyone, we don't necessarily know when they could turn. We don't have those data points. So monitoring more people at in an economical way is just better, right? In general. Talk to us a little bit about where you see this bridge from, at what point do we start to monitor those patients in different populations, their discharge? Now we definitely want to start seeing that monitoring at home strategy coming into play. And then when they're coming back in, right? So talk to me a little bit about that bridge.
Yeah, so hopefully they don't have to come back in, but it's inevitable that some of them would. But yeah, discharging in the use cases we're looking at and being trialed in, the patient gets discharged with our patch already on them, and either using their own device or a hospital provided device, go home and the data streams back to the hospital immediately as they leave or as the patch is activated or powered up. So the hospital has continuously an eye on that patient, and only when something goes wrong does the patient pop up. So it's not as if the hospital or the nurse or whoever is monitoring those patients have to look at each and every one of them. So it's very intuitive, the system, and most patients are okay and they recover. And studies have shown a lot of value in patients recovering at home faster because they're in the comfort of their home, less risk of cross-contamination. There are many advantages. So there's value in discharging with that device and then keeping an eye on them. There's typically, I think, 2 to 3 visits a week with a patient, but with a device like ours, it could be brought down to 1 maybe none if the patient is faring well, and they don't have to check themselves, because obviously, I don't know if you've checked your own blood pressure before, but checking your blood pressure, I get 5 different values every time I check, five times in a row. So
Yeah,
there's always that question of if a patient is checking themselves correctly or not.
that's right.
So it's valuable, and then when the patient comes back and is readmitted, the hospital has that data to look back at and see where the change happened, what happened, and there can be more accurate treatment.
Okay, so I'm a hospital CFO, all right, and I'm looking at the most valuable, like high impact reason to bring in those Vitls wearables. Tell me where I'm going to put them and on what patients.
So one of the strong use cases, I'll mention a few. There's post-operative, so patients typically at risk of sepsis, and that carries over to the home as well. So post-discharge, where typically a patient would be kept in hospital for a day or 2 extra just to be observed, not to receive anything, those 2 days can be spent at home. So the hospital they will reduce costs and also free up a bed so the hospital can treat more patients. So that's a strong use case. Another one would be in the emergency department, where patients would be admitted for a day for observation, which is actually a waste of a good bed for a patient who needs it more. So those patients can be turned around with a patch and sent home and monitored remotely. And so they would get the same level of monitoring, maybe better. They would definitely get better monitoring than they're getting now because it's continuous. But they could be anywhere for that. They don't have to be in the hospital. So those are 2 strong use cases. And then there are many others. Pure hospital at home as well, which is treating low acuity patients and not even admitting them into the hospital. So we're excited about all the use cases. We're trying to stay focused on a few strong ones.
I love that. I love that. Okay, great. Well, I'm really excited for the entire industry to start being more open to this. And I've seen that with our clients. Are really thinking about, how do I make the best use of this new technology? How do I get the most benefit? How do I start really diverging from having to just monitor with very specific, legacy type devices? How do I think about monitoring more patients? So it's great to work with you. We love working with your company and Sickbay, and we would love to start getting all of that working for our clients as well. Raj?
What struck me, there are a lot of consumer wearables out there, which work really well for the folks who have them. Making a medical grade wearable and making it available for everyone, right, who's coming through the hospital, along with a protocol for an expert to watch over them. That, I think, is really helping to fill an important need in patient care, right? The idea that it's like, oh, everybody coming through, if they need a wearable, they should get one and they can get home. It's foolproof in terms of like the data that it's collecting. There's no awkwardness with respect to nudging folks or having them remember to take those measurements. It's just, it's seamless, right?
Mm-hmm.
I think that's all very, very exciting. So I appreciate you coming on today and talking to us a little bit about that.
Yeah, sure. I think one last thing that's important, and it's kind of what you mentioned now. Our focus has been a lot on the device side, but a big or important part of this whole system is the data flow. So, and we've seen a lot of companies try and do all of it, and it's not. You lose quality on something, on one of those parts. So it is valuable to have a system like Sickbay that collates all that data, and with all the other data coming from the EMR and showing that to clinicians in a way that they expect and they're used to, not something new and strange that they have to get used to.
Yeah, I think so too. I appreciate that. If you out there are interested in learning more about Sickbay or Vitls, or you are a Sickbay user and you want to tell your story, drop Michon or me a line. We'd love to hear from you. Until then, take care, and we'll see you next time.